Hello, everyone. Welcome to our show today. I'm Dr. Niki Davis with Love Life Telehealth, and today I am very excited to welcome you all to a very special webinar all about prostate cancer. We will be discussing not only what it is, the current state of disease in the United States, what are some of the typical symptoms to be aware of, screening options, how it's diagnosed, conventional treatment options, and then, of course, how to prevent and treat prostate cancer using lifestyle interventions. And today I am joined by the wonderful Dr. Jeff Pierce, one of the lifestyle medicine physicians who I work with at Love Life Telehealth. How are you today, Dr. Pierce?
I'm fine, Dr. Davis. How are you doing today?
I'm doing well, thank you. Well, thank you so much for joining us. I appreciate that your background is a little bit more exciting than mine. You've got a nice teal color going on instead of just like the beige of my background.
Beige is cool. Beige is calming. That's good.
Yeah. You know, you can always throw a pop of color in when you need to. All right, so I guess why don't we just start out with just the definition? I'm sure most people have heard about prostate, but I don't think a lot of people really understand what exactly it is, what its purpose is, where it's located. Can you just kind of go through just the basics of what is the prostate before we get into the nitty-gritty of prostate cancer?
Sure. Prostate is one of those internal organs. We don't see it. It's inside us. And, I would say most people don't think about the prostate every day. Uh, Unless you happen to be a man and you're in their 60s, 70s, and 80s. And oftentimes when you're going to the bathroom, you're thinking about the prostate because, as we'll talk about a little bit later, prostate can swell and get enlarged and make it difficult to go to the bathroom and pee. But the prostate is a small organ about the size of a walnut, and it is located deep in the pelvis of men. No prostates in the women. And it is up near the bladder and internally at the base of the penis. And its main job is to secrete the fluid portion of semen, and it sort of surrounds the urethra, which is the tube that leaves the bladder and where pee comes out of. And so that's, as we'll see, is one of the reasons why we do have symptoms associated with urination, because the prostate surrounds, is right up against the bladder and surrounds the urethra where we pee.
Yeah. Okay. So, so I know that, in discussing prostate cancer, and I don't know if a lot of people know this, but it is the most common cancer found in men. I think it's the second cancer that results in death in men. But why don't you tell us a little bit about that, kind of the background of prostate cancer and kind of what is the current state of disease in the United States?
Sure. So it's a big deal. Every type of cancer is important, even if it was a cancer that only affected 1 in a million people. But prostate cancer is particularly important because it does affect so many men. And right now, cancer statistics are interesting because when you look at, this is the leading cause of cancer in men, this is the leading, and so is the leading cause of cancer in women, that's usually excluding what they call non-melanoma skin cancer, because things like basal cell carcinomas, squamous cell carcinomas, these things that are not melanoma, but that are little skin cancers that our docs are, scraping off or freezing off or burning off, those are so common, but they also tend to be really benign and unlikely to cause a lot of harm, especially when they're caught early. But so if you exclude those skin cancers, prostate cancer is the most common cancer in men. And something like the American Cancer Society thinks that in 2025, there's going to be about 3 million men in the United States living with prostate cancer. So that's going to be about 1 out of 8 men who are diagnosed in their lifetime, with over 300,000 new diagnoses estimated for this year. And so, and about a little bit more than 30,000 deaths expected from it. So, we're not talking about a rare condition. We're talking about a very common condition, one that should be on the forefront of our minds as men, or people who have a man in their life that they love, and that's why we're talking about today. I will say one interesting thing is that these are our numbers and rates in the U.S., but there's a wide variability in rates around the world. And classically, you see much lower rates in Asia, like Japan and China, and in Africa compared to Europe and the U.S. Those rates in Japan, for example, have increased 25-fold since World War II. And we think that that's largely due to a change in diet over the years. And we'll talk more
Yeah.
about it today.
Well, and that's why I think it's so important that we're talking about this today, because not only is it something that is quite common, but it is something that seems is very lifestyle related. And we'll talk through a lot of the studies that have been done that helped us come to that conclusion that, boy, it does seem that if you live a healthy lifestyle, you have a better chance of preventing prostate cancer. And then also if you've been diagnosed with it, that you tend to do better when you have a healthy lifestyle. So I think it is really important because, you and I, we want people to understand that these kinds of scary diagnoses, you might have where, your father had it, and you worry, when am I going to find out that I have it? And knowing that there is something that you can do to help control your own outcome through lifestyle.
Yeah, I agree. I think cancer is one of the most feared diagnoses out there, and there is a sense of comfort and power the more that you learn about how certain conditions can be prevented and even respond partially, at least, to leading as healthy of a lifestyle as possible. Because, yeah, no one wants to get cancer if you can avoid it. And if you do have it, we appreciate the powerful medicines and other treatment options that a doc or a surgeon can provide, but it's even more empowering when we have some control over it. And the other thing that you said made me think about how, yeah, there's certainly a number of cancers out there where there's no known lifestyle either cause or responsiveness to it. So, I think about a lot of brain tumors, for example, or don't jump out at me as something that, oh, as long as I eat my broccoli, I'm never going to get a brain tumor. And I suppose that's true of every cancer, that there's no 100% guarantee. But there are these lifestyle related cancers that are just more responsive to changes in our diet. And the ones that are often spoken about are prostate cancer, colon cancer, breast cancer. Also, liver and esophageal cancer related to heavy drinking, or lung cancer, of course, related to heavy smoking and things like that.
Yeah, absolutely. So, do you mind talking to us a little bit about kind of some of the risk factors involved in prostate cancer? What puts men at higher risk?
Sure. So the biggest risk factor is age, because the older you are, the higher the chances that you get a diagnosis of prostate cancer. So prostate cancer is super rare under the age of 40, but once you get 50, 60, 70, 80, it just gets more and more common the older that you get. So I think 67 is the average age at diagnosis, but certainly it can be diagnosed earlier. And then a lot of these cases are never diagnosed because they are very slow growing. They stay in the prostate without symptoms, and it's maybe only discovered if there's an autopsy. There was an interesting study that did autopsies on men in their 80s, and about 50% of those folks had prostate cancer, 1 out of 2. So that's extremely common. But those people, tend to, someone in their 80s will often have died of something else, and just kind of found to have prostate cancer, kind of as a surprise, or as a secondary finding. But yeah, did that
Yeah,
start to answer your
with the
question?
risk
Yeah.
factors. Yeah. So you
Yeah.
mentioned
So that's
age.
So that's the unmodifiable risk factor. You know,
Right.
we can do things to feel younger, but so far we have not found anything to reverse age, per se, chronologically. And so, so we can't focus. We shouldn't focus too much on that because there's nothing that we can do about it. But a lot of the risk factors are what we'd call modifiable risk factors. So, what can we do with some of these risk factors so that we no longer have them? For example, okay. So a big one is diet. And there are lots of studies out there that show that diets that are higher in animal products, and there's some specifically that looked at eggs, some that looked at chicken and turkey, and some that looked at processed meat, some that looked at dairy, and there are just multiple studies that show that the more of those things that you consume, the higher risk you have for oftentimes for getting diagnosed with prostate cancer or having more risk of metastases and advanced disease, or dying of the prostate cancer, or having a comeback after treatment. So just on many levels associated with sort of worse outcomes and higher rates of diagnosis. And I think it's important when we're talking about risks, is that most of these risks in general, when you're talking about a medical condition, are often kind of hard to prove. A lot of them are based on population studies where they say, okay, we're going to look at 10,000, 100,000, a million people, and sort of say, okay, fill out these diet questionnaires and exercise questionnaires, and we'll look at the folks that got prostate cancer and the ones that didn't, and we'll try to see what they have in common, what they're doing and what they're not doing. And while those are helpful, they can prove association, but not causation. We're never 100% sure on those kinds of studies. And you know, that was true for smoking and lung cancer. Maybe the vast majority of data coming through on that was just based on population type studies. But so I would say when trying to discuss these things, we'll take all that with a grain of salt. But today we'll be talking about studies not only on population levels, but randomized controlled studies, and also some basic lab studies, and so many of them point in the same direction.
Yeah.
So yeah. Should we talk? Interested in hearing anything more specifically about the diet stuff? What are you thinking?
Well, I think, yeah, I know that as far as diet goes, it seems like dairy is pretty highly implicated in prostate cancer risk. Can you talk a
Yeah.
little bit about why that is?
Yeah, and it talking about all this stuff when we talk about diet, of course, is that it's so culturally tied to, you know, what we were raised on, what our families said was good, what the commercials said was good. And so you know, I always want to approach this with as much humility as possible, because a lot of things that we talk about might be totally new for some folks. But when you theoretically look at dairy, for example, we see that dairy is full of hormones and growth factors, insulin like growth factor 1 or IGF-1 is a big one, that are really good at helping a calf gain a couple hundred pounds in a couple months. And that's really good for the calf to size up and become an adult. Really important, right? Because the calf is drinking his or her mother's milk. And then the theory behind that is that that sort of growth factor and hormone rich liquid can also lead to the growth of certain tumors, cancers, etc. And so, especially once the growing has stopped in an individual, you know, even though I wouldn't mind being an inch or two taller, I'm not growing in that direction anymore. And now the things that are growing, I don't necessarily want to grow, like, you know, a random cancer cell in my prostate or in my lung or in my skin or whatever. So theoretically, that's what it is. On a bench study, on a lab study, there's some interesting ones where they would grow prostate cancer cells in a petri dish, and you know, dripping organic cow's milk on the prostate cancer cells cause them to grow 30% faster. And then other substances like maybe like an almond milk or something like that suppress the growth. And so those are interesting, but I'm not going to hang my hat on some study on a single study in a petri dish, for example. But when you look at also the epidemiological studies, the case control studies where they sort of say, okay, this group has prostate cancer, this group doesn't, and we're going to follow them or we're going to look at the what they have in common and what they don't, or pick a single group where no one has prostate cancer and then follow them over years and years and see, okay, why did that group develop prostate cancer and that group didn't? When you're looking at all those things, it looks like milk, whether it's high fat or low fat, cheese, etc., have been associated with increased diagnosis of prostate cancer and metastatic
And to be
cancer.
clear, this is cow's milk and cheese
Yeah.
from, right? Because milk nowadays, there's so many different options for milk that it used to be that when we say milk, we knew that we're talking about cow's milk, but I think that now it's very common that people are using alternative milks. And so just to be very clear that it's animal-based milk.
Yes. Thanks for that clarification. And thankfully there are a bunch of options for these plant-based milks, and for folks who are wanting to decrease their cow's milk consumption because of things like risk for prostate cancer. There's some good alternatives out there. And particularly soy milk, which we'll talk a little bit more about as a helpful thing to consume when it comes to lowering our risk for prostate cancer.
Okay, and then eggs. How about eggs and poultry as far as ingesting those as a possible that would increase risk of prostate cancer as well?
Yeah. I think eggs is a timely topic because of all of the bird flu that's going around, killing or infecting chickens, and then just so many of them having to be put down to minimize the risk of spread, et cetera, and people having less access to eggs. And so one study, which was done at Harvard, of more than 1,000 men with prostate cancer, they followed those men for several years and, asked them, what are you eating and what are you not eating? And one group that stood out was men that were eating more eggs had an increased risk of prostate cancer progression and metastasis. And remember, metastasis is cancer starts as a single cell and then grows, and then eventually it grows enough that it gets into the bloodstream or the lymphatic flow and goes to other parts of our body. And prostate cancer primarily or most frequently goes to bone, and so bone metastases. And so men who are eating more eggs, and that was even less than a single egg a day, so maybe like an egg every other day or something like that, that was enough to have a signal in the study that they had twice the risk of prostate cancer progression and metastases compared to men who rarely ate those. And so that's, why is that? I don't think I'm sure we're not 100% sure, but one of the theories behind it is that eggs have a lot of the nutrient called choline. And choline is one of the nutrients that can be converted by certain unhealthy bacteria in our large intestine into something called trimethylamine, which is converted in our liver to TMAO, trimethylamine oxide, and that compound is associated with increased risk of heart attack and stroke and premature death, and I want to say also poor kidney function and things like that. And so, and in this case, potentially also the prostate cancer. So the eggs is one where if you want to potentially cut your risk for prostate cancer progression and metastases, is that I would skip the eggs and go for something more like a tofu scramble or something else. There are all sorts of ways to keep eggs out of baking, for example, like using the flaxseed and chia seed and other things like that work really well.
Yeah, they do. And I thought that was really quite fascinating about the choline. I was familiar with trimethylamine oxide and how that is linked to all these additional risks in health. and that studies have been done on people who do not ingest any animal products, and they actually don't make TMAO. And so I did not know that choline and I think carnitine from meat are both kind of the precursors to these unhealthy gut bacteria creating the TMA that's converted into TMAO. So I thought that was really interesting that that's where it originates from. I knew it was meat or, animal related, but I didn't know the specifics.
Yeah, that's my understanding, at least.
Yeah. Okay. Well, great. So, and then I think, some of the additional risk factors that I'm familiar with are going to be, processed meat. We know from the World Health Organization that processed meat is a carcinogen. And then, of course, alcohol, tobacco, and then just having excess weight as well are additional risk factors that I'm aware of. Are there any others?
Yeah, I think you covered them. The alcohol shows mixed results. It's not as strong as the tobacco studies that show more of an increased risk. The carrying extra weight and being in the obese range shows a small increased risk for prostate cancer. And I think the processed meat, so thinking about things like deli meats and pepperoni and bacon and breakfast sausage and these things, it's interesting to think of, because I think more and more people are hearing that they're associated with colon cancer, but they've also been shown to be associated with an increased risk of prostate cancer, and so I think that's important to know as well.
Yeah, absolutely. Okay, well, just quickly, I would love to hear a little bit about kind of what are the symptoms that people should be concerned with. Is this something that men can, if they see a certain symptom, that they should be worried for prostate cancer, or, what are kind of some of the common symptoms that men will have?
Yeah, this is like many cancers. It's tricky that most symptoms aren't early, don't show up early in the course, and you always want to have a diagnosis of cancer as early as possible if it's going to be a real cancer that causes harm to us. We would want to catch it earlier before it has time to be locally invasive within the tumor, within the organ that it's starting to grow, or spreading via metastases to other parts of our body, because that's when it gets life-threatening. And so one, you often don't have symptoms with prostate cancer, especially when it's early. And then two, when you do get symptoms, they're what we call non-specific symptoms, where it could be something else. It's actually more likely to be something else. So classically, you talk about these lower urinary tract symptoms, which are things like some burning when you pee, some difficulty starting the urinary stream, getting up in the night to pee, things like that. All of those symptoms could be common from a bladder infection, from an infection of the prostate, from having just benign enlargement of the prostate, which is much more common than prostate cancer. And so those aren't particularly helpful. And then if you get pain from metastases, like bone pain from the prostate cancer starting to grow in a bone, of course, that is a late finding, something where if you're having that symptom, man, it sure would have been nice to catch it way earlier than that. And so, but those are some of the symptoms that you can get.
Okay, and certainly if you see blood in the urine, that's kind of something you need to make sure that you get checked out.
Right, and probably still more common that it's either a urinary tract infection causing some bleeding in the bladder, or maybe a kidney stone or something like that, but potentially prostate cancer.
Yeah, and knowing that the symptoms are more non-specific, so it's not like, wow, I see this, I'm worried now, I have prostate cancer. It's not like that. Then you think, okay, well, if it's not really something that is obvious with symptoms, then you want to really screen well for it. But actually, it seems like screening for prostate cancer just hasn't really panned out as something that is beneficial for most men. So do you mind if we talk a little bit about the different screenings that actually have been recommended in the past that are no longer really recommended because of the overtreatment that can possibly happen I mean, you mentioned earlier even, that we see, you said in 50% of autopsies of men over a certain age that we're seeing prostate cancer that never actually ended up becoming a problem, isn't what they died from. And so with having some screening tests, how do we, I guess, what are the screening tests, and what do we know about the efficacy of them?
Yep. Great question. And I'm a huge proponent of screening for cancer. Um, uh, but it depends on the type of cancer, on what kind of a job we're doing as a medical profession. So colon cancer screening is kind of a no-brainer. Everybody seems to support that because we can catch precancerous lesions, the kinds of little early tumors that aren't quite cancer yet, and you can do something about them. Those are typically the polyps. So if you have bleeding from a polyp, it'll show up on what we call a FIT test, or one of these tests that are done on a stool sample, that you can now like send in over the mail. Basically, it's like pretty easy to do, or a colonoscopy, things like that, that will be able to see the early cancer. So that's great. Colon cancer definitely should be screened for. Prostate cancer it's got problems for screening. Back when I was in training, an old man would come in for his yearly, and you'd say, "All right, Mr. Jones, it's time to check your prostate." And it was, uncomfortable for everyone in the room. And it turns out that it actually didn't help to decrease the risk of dying from prostate cancer. And so that's now no longer routinely done. If your doctor checks your prostate every time you come in, just as a screening test, or once a year or something like that, they're a bit behind the times when it comes to screening recommendations. Part of that is that, you can't reach the entire prostate, only the back part of the prostate through a rectal exam, and it just wasn't a great test. And so,
And
what about a
the tumor needs to be
big?
big enough also that you can palpate it, or feel it, right, as a doctor.
Right.
So you can miss a lot of those early stage, or something that's more interior.
Right, exactly. And then if you feel a swelling, it still might end up being a benign swelling and not a cancer. And so it's neither sensitive nor specific, is the terminology that we use in that Dr. Niki and I talk about. But in other words, it's just not a great test. So what about a blood test? You would think that a blood test, pretty benign procedure. We should do that. And whenever you're thinking about a screening test, not only do we think about how accurate is it, so that we can, if the test is abnormal, then we're pretty sure that the cancer is there, but we also want to worry about these things called false positives, where if you have that positive test, meaning abnormal test, but in reality you don't have the cancer, then there's negative side effects about that, right? Because, you have a test that shows that you have cancer, and you're worried about it, and the lack of sleep and the stress and the worry associated with that. And then you might have to get a follow-up biopsy, which can be associated with bleeding and infection. And then so if you have an abnormal test, you really would love it to be darn accurate. And then the other problem with these types of screening tests, and right
And you're
now,
talking, when you talk about a blood test, you're talking about the PSA specifically, right?
so
Okay.
the PSA, prostate specific antigen, that's the only really screening test that we have spread out wide, far and wide. And it's it's not really recommended much anymore. And I'll tell you specifically what. But just to finish that last thought, was that even if you do detect the cancer, truly it's a high PSA, and you do have prostate cancer, it doesn't differentiate well between, is that the kind of cancer that you're going to die from, or the kind of cancer that you're going to die with. And so if your PSA is quite high, and if it's high enough, or if it's quite high on a couple of different measurements, then you get referred to a urologist. The urologist is going to potentially recommend a biopsy and some imaging, and then you get your diagnosis, and you try to figure out what's the best thing to do. But with that screening test, the U.S. Preventive Services Task Force, the USPSTF, which is a well-recognized and respected body for looking at the scientific evidence and saying, should we do this test or not do this test? They say men over 70, you shouldn't do it because they're more likely to die from something else than prostate cancer, so it doesn't make sense. And then for men between 55 and 69, that you shouldn't just randomly do it on a yearly physical. You should have a good conversation between doctor and patient about the pros and cons. And the Canadian Preventive Services Task Force basically recommends against screening for all age groups. And they phrase it quite well by saying for people who have for men who have prostate cancer, who don't get screening, 6 out of 1,000 men with prostate cancer will die from it. And then if they did get screening, 5 out of 1,000 men with prostate cancer will die from it. So out of 1,000 men, only 1 life is saved. And there are a whole bunch of like unnecessary biopsies, worry, sometimes hospitalization from complications, and some of the major complications like constantly dripping urine or having erectile dysfunction, and some of these things that can be lifelong. So it's a tricky situation to be in as a doc who really cares for your patients and wants to prevent cancer, but just right now not having a great way to screen for it.
Yeah. And it's so important to have these discussions, because I think a lot of people think, well, why wouldn't you screen for a cancer? It just, and especially if it's just a blood test, it's just so easy. But to really understand what is the benefit I would possibly get, which is 1 out of 1,000 people might save a life from getting a early screening. But what are the possible downsides to getting the screening? Because a blood test is one thing, but if that pops up, like you said, with an elevation in the PSA, now the doctor has to do something about it. And that's where we can get into trouble with people who normally, it's nothing, there's no problem. Actually, it's just from, like you mentioned before, the possibility of just a benign, not a swelling, but, just a increase in size in a prostate happens to most men as they age, right? And that can actually cause an increase in the PSA level that is not prostate cancer. So really understanding the screening, and if it is worth it to you to have that done, knowing that you could possibly have to go through some of these options like biopsies when maybe you don't actually have prostate cancer. So I think it is important to have these conversations about a lot of different screenings as well, so that you understand what is the true benefit and what is the true risk associated with it.
I totally agree. I like how you said, does it make sense for you, right? Because some people are like, hey, my best friend died from it, or my dad or my brother had it. I'm super worried about this cancer. I don't care if I have to go through a biopsy. Like, I definitely want to be screened. Well, that's a great person to screen, right? Maybe you've got somebody who's like, I don't know, I'm on the fence, but I'm smoking 4 packs of cigarettes a day, and I like to rock climb without a harness. And so maybe they have some other problems that might take their life sooner than some diagnosis of prostate cancer. So there are, it's a person-to-person kind of decision.
Yeah, absolutely. Okay, and I want to make sure that we have enough time to talk about kind of some of the lifestyle interventions, that we think about with helping hopefully prevent, or even just help, quality of life and maybe even improved survival in people who've already been diagnosed with prostate cancer. But why don't we talk just briefly about kind of what are some of the more conventional treatments today for prostate cancer that people should be aware of, that they might be recommended if they're diagnosed?
Sure. So your urologist, your specialist in the prostate would say, okay, based on your physical exam, your PSA blood level, looking at this tumor under a microscope and getting what's called a Gleason score, plus imaging to make sure it hasn't metastasized, et cetera. Then you're typically put into a group, and one group might be, hey, super early, super low risk of it growing and metastasizing. You're in the kind of watch and wait group, because studies have shown that there's no real benefit of taking out your prostate right now. And so we're going to keep following your PSA levels at this point and see what happens. We'll keep a close eye on you. There's the group that, okay, you need to have your prostate out, or you need radiation, or you need a hormone blocking therapy of some sort to keep the testosterone low and minimize risk of it growing, stuff like this. So all different recommendations based on that initial thorough diagnosis. So yeah, definitely work well with your primary doc and your urologist, maybe get a second opinion as you are deciding on these things, because they're big decisions. And just like screening, the treatments, of course, have risks and benefits and alternatives. And so it shouldn't be a decision that you make rashly. And just make sure the more information that you can garner on it, the better, to help you decide which way to go. But regardless of which way you go, whether it's you're in the watch and wait group, or hey, you need prostate surgery plus radiation and a medicine, etc., you can in the meantime be doing all of these things that can potentially lower your risk for progression, metastasizing, coming back after therapy. And that's where I think the lifestyle medicine provider role is the most important, is to say, hey, look, based on studies, this is what we know so far. We certainly don't know 100% about each of these things, but we have some ideas, and the side effects from our treatments are going to be pretty minimal while you are going through your other therapy with your urologist.
Yeah, so let's get into that. This is the part that I love the most to talk about, is the lifestyle interventions. So,
Yes.
what can men do to prevent and potentially help treat prostate cancer using lifestyle interventions?
Cool. So, yeah, so we'll start generally and then maybe get more specific. So following general dietary patterns, the more plant-based, the better, based on studies. So a nice study that came out, I think this was one in Urology magazine, but basically plant-based diets were shown to decrease the risk of getting prostate cancer, also having an advanced type of cancer, and also from dying from prostate cancer. And that was specifically looking at men under 65 years old, and that was a study from 2021, so just a handful of years ago. Another study showed, looking at 2,000 men, which was just 2 years ago in 2023, of 2,000 men, and said it showed that the more plant-based they had like a 56% lower rate of progression and a 59% lower risk of recurrence. So that means progression is more like, is it continuing to grow and spread, and recurrence is, okay, you've had it removed via cancer surgery and radiation. Recurrence is whether or not it comes back or not. So it helped with those two categories. And then a third study that I found was they had a group of people who, I'm not ready to go 100% plant-based, but I'll just try to, when looking at protein sources, either animal or vegetable protein sources, they just tried to up their vegetable protein sources to about a 1-to-1 ratio. So you had some animal protein equal to plant-based protein, and it showed a slower progression, and that's based on something called PSA doubling time. So how long does it take for the PSA, that blood test, to double? And the higher the PSA gets, the more likely the tumor is growing, right? So if your PSA doubles in a year, compared to if your PSA doubles in 3 years, it would be better to have the slow doubling time. So anyway, so when they increased their plants so that they had kind of a 1-to-1 ratio, their PSA doubling time decreased, so that their tumors seem to be growing less. And that's something that's good. It's not as good as the results from Dr. Ornish's study, which is one that we'll talk about, but which was basically 100% plant-based protein.
Well, we might as well talk about it. I mean, so let's talk about the Ornish study and what they found.
Sure.
and what the intervention was.
Sure. And so Dr. Ornish, Dean Ornish is an amazing guy who is based in Northern California, sort of in my neck of the woods, and has done a lot of great stuff. Obviously, people watching have probably heard about his work in the 80s and 90s on reversing heart disease, and his diet is consistently highly rated in the when diets are reviewed by the national bodies. He recently published a study on the benefits of plant-based diet, exercise, meditation, etc., for early Alzheimer's. And so he's done great work. One pertinent to today's discussion, he did a study called "Intensive Lifestyle Changes May Affect the Progression of Prostate Cancer," and he grabbed this group of men who were in the early watch and wait group. So they had a Gleason score of less than 7, which is so very, very early and mild prostate cancer, with a PSA between 4 and 10. And one group were the control group, and basically they didn't get any kind of they didn't change their lifestyle. They were just the group that stayed steady. And then the experimental group was put on a vegan diet with extra soy, some supplements, and vitamins. And then we're doing about 30 minutes of walking 6 days a week and an hour a day of meditation. So pretty intense on the meditation. And then followed along and wanted to see how did those two groups do compared to each other. And so this is what's called a randomized controlled study, and it minimizes a lot of the shortcomings of some of the other studies that we've talked about. And what was pretty amazing was that men who were making those healthy changes saw their PSA levels start to fall, and that tends to go with a tumor starting to regress. And then the PSA levels in the control group that weren't doing anything different, the PSA levels continued to increase, which is pretty typical in the watch and wait group, that over time, the PSA levels slowly go up. They looked at who needed surgery and who didn't, and no one in the vegan side of the study needed any cancer surgery. And then 6 in the control group needed it. So it helped. It seemed to help avoid surgery and also see the PSA go down, meaning hopefully that the tumors were stagnant or even starting to regress a little bit. And then he did some, as part of this experiment and some related experiments, he did some interesting things where they drew the blood of people from both groups. And the people in the do nothing special group, when they dripped that onto the prostate cancer cells, it seemed to prevent a little bit of the prostate cancer cell growth, about 9%. But then when they drew the blood from the healthy or eating and meditating and exercising group, and dripped it on the prostate cancer cells, those cancer cells were inhibited 70%. So 70% inhibited versus just 9% inhibited. So an interesting little side part of that of study. And then the last part that I'll mention about a study was they, on a separate study, they looked at changes in genes. And so we know we're all born with genes from our mom and dad, and you can't do anything about your genes that you inherited, but you can do so much more about whether those genes are turned on and off, sort of like a switchboard. And so what we eat, how much we sleep, how much we exercise, etc., determines whether some of these genes are turned on or off. And they looked at the two groups, and in the healthy group, in the group that was going through all those really healthy interventions, it showed that within 3 months, 500 cancer promoting genes were turned off or down regulated, to use the terminology, and 40 health promoting genes were turned up, were upregulated. And so on a genetic level, on an epigenetic level, what we talk about when we're turning on and off our genes, you saw major changes just within 3 months of doing this intervention. So So when you're looking at all these levels, from the cells in a petri dish to the genetic changes to the clinical outcome, and you're putting it all together, you're like, wow, this really seems like there's something to it.
Yeah, I that's really, really fascinating, with not only dripping different milks onto the cells, but also dripping the blood samples from the different groups onto the cells, and then the tumor markers as well. That's really fascinating. Um, why don't we? I want to talk a little bit more about the specific foods that we should maybe that we have some data on as far as plant-based foods and how those can help with prostate cancer prevention and possible treatment. But first, it looks like we do have a few questions. I wonder if we should just answer a couple of those.
Sure. Sure.
So perfect. So we have, I'm supposed to get an MRI as a precautionary view of my prostate. Should I not do this?
That's interesting. So, assuming that means, and while we can't give specific medical recommendations on this channel, because we haven't established a specific doctor-patient relationship, speaking in general, for someone who does not have a diagnosis of prostate cancer, doesn't have an elevated PSA, and the doc's like, yeah, let's just make sure you don't have anything. That's something I have not heard about. I'm not a urologist, but that's not something that I'd come across. There are folks who are sometimes thinking about, I'm going to go to an imaging place, or my provider's recommended that I get kind of a total body scan and just see if there's anything brewing. And that's also not recommended, because if you find something, related to that PSA discussion earlier, what does it mean? It probably means a biopsy. Did you need the biopsy? What are the downsides of that? So if it's just sort of like, hey, let's just look at your prostate, see how it's doing, that's not standard of care. But if it was something, yeah, so I'm kind of surprised by that recommendation. Interesting.
Yeah, yeah, it is. And I think, this is where having a doctor, like a lifestyle medicine doctor, can really go through, what are the current recommendations out there? Because we are conventionally trained doctors, right? That are also boarded in lifestyle medicine. And so we can go through and really dig in and see, well, why is your doctor recommending this screening test? And then we can discuss that option and whether or not it's something that you actually want to do or not. And I have those conversations with people a lot, where they say, well, my specialist is recommending this, or my primary is recommending this. And then we just talk through, okay, well, here's why I think they're recommending it. Here are some of the benefits. Here are some of the risks associated with it. And then you get to make that decision on whether or not you end up going through with it or not. Because you're going to get different recommendations from different doctors. We don't all practice exactly the same way, even though we do have certain things that we can follow, like the U.S. Preventative Services Task Force, and look at their recommendations. But they even have to grade their own recommendations, saying, we think this is a good recommendation. It's an A. This one's not as good. It's a B. This one's maybe a C. And you have to really decide on your own as a physician and with your patient if that makes sense or not to actually follow that.
Yeah.
Okay, we have another question from Dan. What are the best non-invasive tests that you could recommend for prostate cancer? So I'm guessing he means, again, screening. That's tough, right? Because non-invasive would be doing a PSA test, which is just a blood test. But again, if you get that done, you have to be prepared to follow up with whatever the recommendations are if you have a high PSA. And that may involve getting biopsies, which you didn't end up needing, right? So that's, I don't know if there's any other non-invasive tests that are done. We just don't recommend the digital rectal exam anymore because it's just really not beneficial. That's slightly more invasive, I would say, than a blood test. But I don't know. What do you think, Dr. Pierce?
Yeah, I mean, I think there is what I didn't do a good job of earlier is say there's the sort of routine asymptomatic screening. Oh, it's January, it's time for your prostate cancer screening, versus I have symptoms. I have an increased risk, right? It seems that there's increased risk often in African American men. So, will come up. Hypothetically speaking, you're an African American man, your father and brother had it, and you have difficulty urinating, right? Like that is different than random person who's lower risk and has no symptoms. Should I be screened? So the two different groups.
Yeah.
But as far as just run of the mill, should I get my colon cancer screened and my prostate screened? Should I do a mammogram if you're a woman? Like these sort of just routine screening. PSA, as far as I'm aware, is the only widely accepted form of screening if you decide to do it in discussion with your doctor between the age of 55 and 69 in America.
Yep.
Yeah.
Okay, great. All right, and then we have one more here from Sid. Hi, Sid. What about a man in his early 70s whose PSA level has varied between 6 to 13 for over 8 years? He read The Great Prostate Hoax by Richard Albin, the doctor who discovered PSA and chooses not to do them anymore. And that's something actually that I'm familiar with, that the man who came up with the test doesn't actually recommend that you test people using that anymore. And when I say test, I mean screening specifically of what we just discussed, that this is someone with no symptoms whatsoever, that just it's a routine screening. If you have symptoms, that's no longer called a screening test, right? You're not screening for something. This is now you're trying to diagnose based on symptoms.
Yeah, great point. Yes, interesting. So this is an interesting case about the man in his 70s who now has PSA levels, multiple that are high. 6 to 13 are high levels if we're using the same units that we normally use here in the U.S. So that's a tricky one, right? I would look at family history. I would look at symptoms. I would look at the overall pattern of the PSAs, right? Did it start at 13 and now it's 6, or did it start at 6 and now it's at 13? If it's bouncing all the way all over the place, that's even tougher to know what to do about. But at those levels, I would, if I was the primary care provider in this case, I would make sure that person is talking to a urologist because the PSA levels are quite high and the stakes are higher, and having that discussion. So it's a tough one. It's definitely a tough one. The other part, of course, and if this is the general health of that person, and so somebody with those PSA levels, but that happens to have end-stage congestive heart failure and can only walk to the kitchen and get short of breath, I would definitely not follow that up, because the heart is what's going to take someone sooner. But if that person is a young 70 and is going on 10-mile hikes every week and stuff like that, then that maybe I will take a look and see, because I want to live for another 30 years on top of this. And so these are challenging decisions to make.
Yeah, and just, and that just kind of brings up the point of how important it is to have a provider who you can have these discussions with, because every person is a little bit different, and so having that real conversation, especially with a lifestyle medicine doctor, where you can talk about, where are you at, because there, 70-year-olds are going to be very different from each other, right? There's the young 70 and there's the older 70, and that is going to play a part in whether or not it's worth really digging into this more or not, or just allowing it to kind of just watch and wait and not do much more with it. So that's really having somebody on your side who you can have these frank discussions with, so that you feel comfortable with how to move forward.
Sounds good.
All right. Okay, so I know we've only got about 5 minutes left, so I want to make sure that we talk through some of the different plant-based foods that have been shown to be helpful with prostate cancer. Can you talk
Yeah,
through some of those?
Let's go. We'll go a little bit rapid fire. So
Okay.
soy seems to be protective by decreasing risk of cancer, probably due to those healthy substances called phytoestrogens, specifically the isoflavones. And so they were showed in a study of Adventists in Southern California to potentially decrease the risk of getting prostate cancer. Other beans, because soy is a bean, other beans in the legume family there have been shown on a meta-analysis, so a summary of multiple studies that seem to be helpful for decreasing risk. Flax also has those healthy isoflavones, something lignans in this case, a healthy component in flax. And multiple studies with flax seem to show that it could be helpful, both bench work and epidemiological studies and clinical studies where men are put on maybe 3 tablespoons a day of ground flaxseed and they see their tumors becoming less active. Or less likely to progress from sort of a precancerous prostate condition to a cancerous condition. So, so if you have early prostate cancer, I would definitely recommend trying that 3 tablespoons a day of ground flax. Make sure you grind it because unground flax passes through us pretty easily and will help us go to the bathroom, but doesn't help us internally as well. Vegetables, particularly with a focus on the cruciferous vegetables, broccoli, cauliflower, arugula, kale, kale, collards, bok choy, pak choy, etc. Seem to have been shown to potentially decrease prostate cancer progression by more than half. Some potential for mushrooms to help decreasing PSA levels. Lycopene, which is found a lot in tomatoes, but also watermelon, papaya, pink grapefruit, seems to decrease risk. And in tomatoes, lycopene is more active in cooked tomatoes. So tomato sauce, get your veggie pasta and your veggie pizza and all that kind of stuff going. One study showed that 3/4 cup a day of tomato sauce for 3 weeks decreased PSA levels and free radical damage. Coffee may be protective, and that included decaf as well. And exercise, there's some mixed results in that, but potentially helpful for prostate cancer. And we certainly know it's beneficial for other conditions like heart disease and other kinds of cancer as well. So those are the foods. That's the comment on exercise. Supplements, Niki and I recommend to get your nutrition through the food more than supplements whenever possible. The exception is vitamin B12, which we do need to get in a supplement form for people who are 100% plant-based. But there was some supplements used in that Dean Ornish study, so take a peek. We should have a link to that study available so you can see what he used. But in general, focusing on the foods is probably where it's at. Don't take lycopene supplements. The studies show that those might actually, in high enough doses might be cancer promoting. So just get the lycopene from tomatoes and papaya. Yeah, that's pretty much it. If I were to come up with like a quick action plan for folks who want to, okay, let's boil it down to what can I do to prevent and what can I do to help co-treat while I'm working with my urologist, I would say switch to a plant-based diet as close to 100% plant-based as you can get and focus on brassica family vegetables like the broccoli, mushrooms, tomatoes, soy, and other beans. Make sure that you get beans every day of some sort. 2 or 3 tablespoons of ground flaxseed a day. I would avoid eggs and cow milk and poultry and processed meat as much as possible. And stay hydrated with lots of water, green tea and coffee, which may help in the prostate cancer world. Get regular exercise, quit smoking, sleep well, reduce your stress, because there is that meditation component in Ornish's study, Dr. Ornish's study. And yeah, just work closely with your primary doc, with your urologist, and a lifestyle medicine doc if those other docs tell you there's nothing that you can do with your diet, so go out and eat whatever you want.
Yeah. Well, thank you so much. You just boiled it down perfectly here at the end, and it's been such a fantastic talk today. I mean, I learned some things. I hope that everyone who watched learned some things about prostate cancer. A lot of modifiable risk factors to help, prevent and possibly help treat prostate cancer. So thank you, Dr. Pierce, again for joining us today. Now, for those of you watching, if you have not had the pleasure of working with one of our amazing doctors yet, now is probably the time. Maybe you are suffering from chronic conditions. Maybe you just want a doctor who is on your side and supportive of your lifestyle. Are you sick of all the medications or you just don't feel your best? Well, please come visit us at telehealth.love.life to make an appointment. We have 5 amazing doctors who cover all 50 states, DC, and international. You can go to our website at telehealth.love.life or even just call us at 888-420-7284. We would absolutely love to hear from you. Until next time, I'm Dr. Niki Davis with Love Life Telehealth.